Innovation has become a top priority for hospitals and health systems. In order to transform the way we care for patients, train our people, and reduce costs, healthcare leaders are investing more time and resources than ever before. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hitterly, Senior Writer for the AHA. In this podcast, Jay Bhatt, Senior Vice President and Chief Medical Officer, talks investing in health innovation with Jonah Michael, Senior Vice President of First American Healthcare Finance. We now go to Jay Bhatt.
Innovation has become a top priority for hospitals and health systems. In order to transform the way we care for patients, train our people, and reduce costs, healthcare leaders are investing more time and resources than ever before. Hi, I'm Jay Bhatt, Senior Vice President and Chief Medical Officer at the American Hospital Association, and I'm here today with Jonah Michael, Senior Vice President at First American Healthcare Finance, exclusive sponsor of the AHA Innovation Challenge, to discuss what hospitals are doing to invest in innovation and its impact. Jonah, thanks for being with us. We look forward to the conversation.
Appreciate it, Jay.
Well, let's get right into it. We know that innovation sometimes is used as a buzzword in healthcare. We have the Innovation Challenge. Hospitals have innovation teams, and the field is forming new partnerships with innovative partners and vendors. Jonah, you work with hospitals across the country. What are some of the healthcare innovations you are seeing from providers, and what types of equipment or technology do you find hospitals are investing in most?
Bullseye, Jay. The innovation is one of the hottest topics right now. And we're seeing just a wide range of investments into that front. It doesn't always have to be IT related, doesn't always have to be medical equipment related, but the Innovation Challenge with the addressing the social determinants of health, we're seeing providers do everything from leveraging all of the data they've collected through their EHRs, using that information and working with some other nonprofits such as 211.org to kind of compare those statistics and really pinpoint certain areas where certain types of innovation and changes are needed to address some of those social determinants of health. So aside from things like that, a lot of telehealth going on. I think it's something like 20% of America lives in rural communities, and a big challenge for rural communities is access to healthcare. And so telehealth, a lot of organizations are seeing that as the way to bridge that gap. Also, the approach of micro hospitals and partnering with other organizations like FQHCs and other providers out there. And then there's the fun things like I read the other day some hospitals in Texas investing in Moxie. It's a robot that is doing about 30% of the work that nurses would traditionally do that's non-patient facing. So it's enabling them to just be more involved with the patients and obviously increase the patient experience on that front. So very exciting things. The last year's Innovation Challenge was addressing the opioid crisis. And one thing we're seeing a lot of is involving education around things like food pharmacies. Instead of prescribing drugs to curb some cases, better health, better ways of eating and different nutrition that they can do to help curb things like diabetes and get their life back on the right track.
Excellent, Jonah. Those were fantastic thoughts. And I think what you're illustrating and painting the picture of is organizations that embrace innovation and are thinking about different ways to solve problems. And I think that's what successful innovation does, problems that have inadequate solutions. So we're really excited to see that. There are some hospitals that don't embrace innovation and shy away from it because it requires potentially significant capital investment, or they think that innovation is not them, it's only for large systems. If a provider hasn't embraced technology or innovation, what are some cost-effective ways to get started? So how do you get the ball rolling? And what financing strategies have you seen work for hospitals to invest in innovation?
So as far as getting the ball rolling, some maybe low-hanging fruit, when the Affordable Care Act and especially the High Tech Act rolled out, everyone got on board with electronic health records, and they've been collecting a ton of data since. So taking a look at the information that your organization already has, analyzing that, maybe perfecting some best practices around putting in good data, consistent data, and leveraging that information to really figure out within your community what needs need to be addressed. That can almost be free of charge. Just really work with your data experts within the organization. That, and there's other different organizations, nonprofits, healthcare providers within the community that have very similar interests. So I think, we hail from Rochester, New York, and there we have the University of Rochester has partnered closely with the YMCA to offer a lot of services for YMCA members, and it just makes it a little bit more known.
That's neat, yeah. So innovation and financing is really important. What financing strategies have you seen work for hospitals so that they can invest in innovation?
First and foremost is leveraging data or getting good medical equipment, the latest and greatest to work. You have to have an infrastructure within your organization that can support that leading edge technology. And that requires having a robust infrastructure, whether that be in-house data farms or a lot of healthcare organizations we're seeing are moving to the cloud to leverage that more flexible, never-ending availability for utilizing that data. Just getting the IT front in line so that you can take advantage of a lot of technologies and different opportunities that are out there. As far as financing that, leasing and financing is one thing that we've seen as a way to manage the refresh of technology instead of having these spikes in the budget. I think we all know that Windows 7 is going to be stopped supported as of January next year. Healthcare providers maybe didn't plan for that, and that leads to vulnerabilities. Financing or leasing technology equipment gives you kind of a predictable line item, just like paying the utility bills, that it makes it so that your organization can be proactive when it comes to different medical equipment technologies and IT technologies versus reactive, and that's slowing the process. Aside from that, large organizations have leveraged their balance sheets to secure long-term financing for soft projects that they traditionally, banks would maybe shy away from. And then rural communities, it's all about getting that grant funding, utilizing your community to do fundraising, and then leveraging government programs in junction with financing through banks, USDA guarantees, et cetera, to get some of these projects off the ground.
Excellent. Those are wonderful strategies, and I think you've given certainly our audience food for thought there. And the other thing that I'm seeing in the financing world is the use of social impact pay for success models, formerly known as social impact bonds, and ways that which an intermediary could help facilitate private investment in government or nonprofit organizations that may not have the capital to address some of these tough challenges that we're seeing in the environment.
Yeah, especially for some of those rural communities I mentioned earlier.
All right. So some say that until recently, healthcare has been slow to embrace digital innovation, but that's changing every day. We're seeing record numbers of investments in digital health. With the hospitals that are making significant investment in technology, what challenges are they now solving for?
Well, I hate to sound like a broken record, leveraging that information that they have when investing in these significant health records is probably the biggest line item expense for some of these organizations. Getting that good data and then partnering with other providers in the community, you're able to target very specific cases, conditions by geographic area. I know in St. Louis they call it the Delmore Divide or something like that, where the health south of Delmore Street is much worse than north. And so by collecting a bunch of information, they've been able to say, here's the exact services that we need to educate this population about. And here are some ways that we can leverage some apps or other technologies to get in the patient's home, because a lot of times the challenge can be getting them to the provider. So finding ways to connect with them in an area that they're comfortable and already there. So that's some of what we've seen recently.
Excellent. And I think successful innovations, from my perspective of what I'm seeing, is there are those innovations that help consumers to solve problems, to make the progress they need to, while addressing any anxieties or inertia that might be holding them back. Yeah. Because, folks will say that innovation is challenging, it's hard to do, we don't want to change. But if you were to give them a lottery ticket, their lives change, and they'll say, sure, bring that on. But in this kind of environment, we're seeing change as part of what needs to be managed in the work of innovation. Yeah. And so jobs to be done are complex, they're multifaceted, they require sort of trial and error, learning. And so I think that that's really been interesting to see how organizations are addressing it. And the other interesting thing we're seeing is how members are collaborating, this sort of co-opetition mindset in which they're collaborating to scale transformation. So they identified a problem, for example, on generic drug access and affordability. And so Intermountain convened some systems, and then came Civica, which is an example of how members are collaborating together. We're seeing that with our own chair's organization, Brian Granulotti, CEO at Atlantic, who's brought together a set of organizations to figure out how best to care for their employees, called the Health Transformation Alliance.
Yeah, with all the different advancements in healthcare today, what are some of the most unique or impactful advancements that you're excited about maybe down the line?
Sure, I think that digital innovation will be interesting to watch. I think part of the challenge there is that digital innovation has been developed at times without the perspective or experience of the frontline caregiver. And that, I think, makes operationalizing it, adoption, difficult. But I still think that's an area to watch. Along with that goes AI and machine learning. The other is, I really think that there's going to be unique partnerships and collaborations that'll happen with unlikely partners. And so that'll be interesting to watch, whether it's finance and healthcare, whether it's education and healthcare, whether it's using lessons from manufacturing and retail and applying them to healthcare. But I think the number one reason that innovation is necessary is that we've got an affordability crisis in healthcare in America. And so I think if we're going to solve that issue, we've got to also think about how do we do it so that we're delivering better outcomes at lower cost, and that we're impacting labor costs as well as technology costs, because sometimes the technology may seem great and may seem like it could solve a problem, but in fact, it might create an expense. So if your technology leads to false positives, then you have those folks coming into the care setting who are driving up expense, but they don't really need that care and evaluation.
And Amazon, Berkshire Hathaway, JP Morgan kind of announcing a collaborative effort to address the issues in healthcare, but also Uber Health. You think of an ambulance ride, $2,000 for someone that may not have that necessary emergency need. Uber is trying to find a way to get involved to curb some of those expensive ambulance rides. And it was $40-something to get to the airport or get here from the airport. So imagine being able to, instead of paying $2,000 for an ambulance ride, hop in an Uber to get to the provider of choice.
Yeah, this non-emergent medical transport opportunity has been really catching fire. We're seeing a lot of organizations use Lyft or Uber as a way to help support that. Again, it's sort of what problem they need to solve is missed appointments, transportation deserts, and other ways of getting folks to the care settings they need. So why don't we talk about collaboration a little bit more, as we brought that up before. Healthcare is a collaborative effort. We know that the vision we have, a society of healthy communities where all individuals have their highest potential for health, can't be achieved without that collaboration. And hospitals are now extending their reach and partnerships outside of their four walls, redefining the H. Can you explain how hospitals that invest in innovation can strengthen the care continuum and improve community health? Really the subject of the innovation challenge that we're so proud to work with First American on.
Yeah, exactly. That's a great topic. Like the one example I gave, the partnership between University of Rochester and YMCA in our local area, being able to utilize the foundation of the Y and the concept of fitness and better living, and also working in partnership with some of the insurance providers as well, and making sure that they're offering incentives to have people have healthier lives. And I get $300 just for going to the gym a few times. I still have to figure out how to do that, but it's something we're seeing all the time. And when you think about the care continuum, call it cradle to grave, if you will, a lot of organizations are reaching out to other nonprofits that maybe help address family planning issues, so that infant mortality rates are dropping and children are having healthier starts to life, because back to the subject earlier, it's just the education. And so getting to the people that are planning families and making sure that they have proper education and planning around that leads to better results when it comes to infant births, and then utilizing all the information you've collected about a patient and making the right decision in time to move to a senior living setting or to a hospice setting, the best care possible. Those are the type of partnerships that we're starting to see in the collaborative efforts. Obviously, M&A activity is very prevalent and has been for a number of years. I don't think we're going to see that slow down much, and I think we'll see even more collaboration getting further outside of just the acute care space.
Excellent. And you brought up the issue of maternal and infant health. The American Hospital Association has been advancing their initiative better health for mothers and babies, in which we're seeing both digital technology and innovation, as well as unique partnerships in the postpartum period, the prenatal period, and even thinking about different ways to improve operations and workflow during pregnancy.
I think last year's second place winner innovation challenge was
that's right, from Penn.
The Better Motherhood, I believe.
It was about addressing hypertension.
Exactly.
And using technology and alerts and a way to help consumer manage their care effectively.
Yeah, and a lot of the ideas we hear and a lot of the themes we're seeing is leveraging apps. I think 81% of Americans have a smartphone at this point.
Right.
So that's a pretty broad audience to reach. I think the next thing we'll see is, I think it's 50% of Americans have some sort of fitness tracker and wearable devices. So we just need to innovate and figure out a way to connect that to the healthcare world so that there's more real-time tracking and being able to address issues before they become issues or react much more efficiently and effectively than currently available.
Yeah, and I think, there's a lot of data that is available and will continue to become available for point-of-care action. And I think that we've got to look at the market segments differently. So rural hospitals, critical access hospitals versus health systems versus community systems. They may have common challenges, but they're also in different contexts and environment. And so innovation plays out, in different ways, given the resource capabilities, et cetera.
Yeah, and innovation can help bridge a lot of the challenges for the rural communities. I think something like 60% of traumatic deaths occur in rural communities, even though it's like 20% of Americans that live in rural areas. Telehealth has been a big way to bridge that gap and get it's tough for some of these rural hospitals to attract the top physicians in the country. They want to go to some of the urban areas, some of the more pristine locations. And so being able to offer those services in a small hometown that you'd have to get by driving 2-3 hours out of your way is something that is a common topic that we're hearing.
Yeah, telehealth's huge, both in mental health, as well as chronic disease. I think an opportunity there is around prevention. We don't use telehealth for prevention, but I think there's a unique opportunity because it's typically used for sort of urgent, acute care or to triage. But in those moments, I think you can do some upstream work.
Yeah.
So, Jonah, who are some innovators, past or present, you most admire?
So let's go past first and then one present. I know a lot of people probably expect me to say Steve Jobs, but that's the easiest one. I'm going to go Thomas Edison. I mean, the guy was just dedicated to innovation on all fronts. He held over 1,000 patents, and the work that him and his team did in Menlo Park are still prevalent in every aspect of our lives today. You look at the work he did with, obviously, the light bulb. Everyone has lights in their home, their business, everywhere. It's just brightened the world, literally. He wanted to have every resource available to his team. The 2 city blocks that he had in Menlo Park for all his innovators, every screw available, every wire, every thing you can think of, so that his team was left to their imagination. It wasn't a limit on resources, which I know is a big challenge today. But he continued to reinvest in his innovation. I think he sold a patent for $10,000, which is equivalent of $200,000 today, took all that money and invested right back into that. So Thomas Edison, got to give a shout out to him. And Bill Gates, he changed the computing world. It's a classic garage startup story. And to tie it back to healthcare, him and Melinda's work in addressing healthcare issues worldwide is absolutely commendable. And getting other very wealthy individuals on board to help drive that cause forward is something that I would not only appreciate the innovation that put him in a position to do that, but his dedication to really giving back and trying to make healthcare better for everyone.
Yeah, those are great thoughts. And I resonate with both of them. And whenever I think of the light bulb, I think of Thomas Edison. And whenever I'm thinking of ideas, it's Thomas Edison. It's like, boop, there it goes. And Bill Gates and a number of others have really changed the game on how we think about computing and use that in our day-to-day lives. Yeah. So looking ahead, what would you say is going to be the catalyst to keep the momentum going? What's going to keep us hungry and wanting to continue innovating as opposed to getting caught up with the challenges related to innovation?
The necessity to do so. It's when organizations like Amazon and Uber and Google get involved because they see the opportunity, it's, I think, over a $3 trillion market in essence. in the United States, they will change the way people thought of healthcare before. And the traditional provider, we build it, you come, has to change. It's already starting to. We see a lot more involved in the outpatient world, opening up more clinics and partnerships with doctors groups, et cetera. But it can't stop there. It's got to get into the homes of patients, and whether that be from an educational standpoint, whether that be apps on their phone, or whether that be incentives for kids to start leading healthier lives. I think that earlier we can address just health in general and leveraging technology, which, I mean, my 2-year-old daughter taught my parents how to use an iPad. The digital natives now, I think, is the next generation, is everything's going to be about technology. So to make them more aware of fitness, encourage them to do more fitness-related things, I think it'll just help healthcare year after year.
Great. Well, before I close, anything else, messages you want to deliver or say that you didn't get to?
A lot of innovations happened in the past 10 to 20 years. What do you see coming from all this momentum?
So I think that telehealth, it will continue to grow and be applied in different ways. I think the ways that innovation can get categorized and thought about, and we'll continue to see this, mindset change, process innovation, and then business transformation. How do you change the game on the business you're in and do that business work differently? On process, I think that there is innovation happening that's a new process or approach that creates value for the organization or the customer. I think that that'll continue to be seen. When we think about it, just thought about it as a shiny new object, but I think there's a lot of opportunities for just rethinking ways that we do work differently. For example, our age-friendly health systems work, which we're deploying a bundle called the 4 M's, mentation, mobility, medication management, what matters to you. And that's in partnership with the John A. Hartford Foundation and the Institute for Healthcare Improvement. We've got now over 300 sites of care that are deploying this bundle, and we're seeing real outcomes and impacts on costs with this. One example is with Anne Arundel, one of our pioneer sites, that asked the question, what matters to you, systematically for every patient that came through their doors in the emergency room or that was admitted 22,000 times over the course of a year. They took the discharge time from ED to discharge, wait time, readmission, length of stay, pull that together into a time for what matters bundle measure. And so as a result, they saw that they were giving back 10 years of time to patients over that course of that year.
Wow.
So that's the kind of, I think, innovation that we don't necessarily always think about, but will become more and more important as we combine it with breakthrough innovation and disruptive innovation as well.
Yeah.
But I think it's important to say, what problems are we seeing and how we're helping consumers solve them and organizations solve them?
Yeah, I think innovation is ways to address the fourth point of the quadruple aim now, which is simplicity. I think healthcare can be a intimidating thing for a lot of people, and I think innovation is going to be the catalyst to lead to making it more simple and easier for people to access and address rather than put it off and ignore it because they don't know what to do.
Right. It's the convenience and simplicity for the patient and their families.
Yeah.
And even for the care team, make it easier for everyone to do the right thing.
Yeah.
Jonah, it was a real pleasure having you here today, and we really appreciate our strong partnership with First American Healthcare Finance on the Innovation Challenge, and we really have been grateful for the opportunity to work together. And thanks again, Jonah. We really appreciated your comments and insights today.
Yeah, appreciate it.
Be sure to watch for the 2019 Innovation Challenge winners announcement taking place at the AHA Leadership Summit in San Diego, July 25th through the 27th. And thanks to everyone for listening.